Howdy, my name is Carla Reyes, and this is my psychology and film project. I'm going to be analyzing the character Ray Monroe from the movie Fractured. Ray, along with his wife Joanne and daughter Perry, are on a road trip when they stop for a break at a rest area. There, Ray and Perry fall into an open construction site and are injured. This prompts Ray and Joanne to rush to the hospital. At the hospital, Joanne accompanies Perry to the basement to obtain a CT scan, while Ray agrees to wait in the waiting room and passes out from exhaustion. When he wakes up, hours later, he asks the hospital staff if he can see his wife and daughter, but is told they were never brought to the hospital, so he begins to argue with the hospital staff, but they continue to deny that his wife and daughter were never admitted. Ray gets the assistance of two police officers, but the hospital staff and doctors convince them Ray came to the hospital alone and was treated for a head wound, so he must be confused. Unable to convince the staff and police of his story, Ray searches for his family on his own and eventually finds them in a sub-basement just before his daughter is about to have her organs harvested. Ray fights with the hospital staff, causing an explosion, and escapes with his family. Except all of this is a lie because Ray suffers from schizophrenia. As Ray drives away from the explosion, it is revealed that he is experiencing visual hallucinations from psychological trauma resulting from the incident earlier that day. In reality, Perry died from the fall and Ray accidentally killed Joanne after pushing her. Schizophrenia is a psychotic disorder characterized by major disturbances in thought, perception, emotion, and behavior. Symptoms include hallucinations, delusions, disorganized thinking, disorganized abnormal motor behavior. There is no single condition that can be tested or measured to produce a definitive diagnosis. Without such measures, the disease is diagnosed by its symptoms. Although treated by a professional, Dr. Isaacs, Ray Monroe is never explicitly diagnosed with schizophrenia in the movie. Instead, Dr. Isaacs focuses more on pushing Ray to remember the sequence of events that led him to the hospital in order to build a case with the police force. The movie is set in the United States, where 1% of the population suffers from schizophrenia. Schizophrenia in the United States has stigma, discrimination, violation of human rights of people with schizophrenia. Schizophrenia is associated with considerable physical and cognitive disability that may affect educational and occupational performances. In the world, schizophrenia is often misconstrued for dissociative identity disorder, also known as multiple personality disorder. These disorders are sometimes confused because the word schizophrenia derives from the Greek schizo, which means splitting, and phrene, which means psychotic functions. Schizophrenia affects 20 million people worldwide, but is not as common as other mental disorders.
Ray, you're not seeing things clearly. I got you. But you're not thinking clearly. You're deeply confused.
In the movie, the trauma of realizing he killed his family caused Ray's mind to construct a new reality in which both his wife and daughter are alive. Ray believes he's rescuing them, but it is revealed that he has kidnapped a random patient from the surgery while his wife and daughter are lying dead in the trunk of his car.
There's something wrong with this place. I showed you the picture. That could be anybody.
I'm as concerned about them as you are.
Search the hospital!
In the movie, there is an emphasis on paranoid delusion, which is the belief that other people or agencies are plotting harm. As part of the new reality, Ray is convinced that the staff at the hospital conducts illicit organ dealing within the hospital basement, and his daughter and wife are the next victims. He believes he's the hero saving his family. Although Ray's case of schizophrenia is advanced, he does not show any sign of abnormal motor behavior. which are unusual behaviors and movements, such as becoming unusually active, exhibiting childlike behaviors, such as giggling and self-absorbed smiling, or displaying odd facial expressions and gestures. As an example of what this symptom looks like, I will play a bit of The Joker, which was also released in 2019. While there is no cure for schizophrenia, it is a highly treatable disorder. Because Ray experiences acute symptoms of schizophrenia, he requires intensive treatment, including hospitalization to treat his severe delusions and hallucinations. Treatment may also include antipsychotic medications, which are usually taken in daily in pill or liquid form, or in some cases they are taken as injections twice a month. In addition to medication, they may also go through psychosocial treatments, which are treatments that help patients with learning and using coping skills to address the everyday challenges of schizophrenia. There is clear evidence that all-style mental hospitals are not effective in providing the treatment that people with mental disorders need and violate basic human rights of persons with mental disorders. More than 69% of people with schizophrenia are not receiving appropriate care. 90% of people with untreated schizophrenia live in low and middle income countries, so the lack of access is an issue that needs to be addressed. Personally, I think the movie Fracture portrays a dangerous, violent, and unpredictable side of schizophrenia, which contributes to the general portrayal that films have of mental health disorders as highly stigmatized, inaccurate, and overemphasize the stereotypical negative attributes. These are my references. Thanks and gigum.